Our focus is really on global health equity and leveraging technology and including generative AI in ways that can help achieve global health equity. So we look at whole person health, really, how are individuals maintaining physical, mental, and social health and well-being. We look at technology in everyday life, and digital health and the use of digital health tools to improve access to health and delivery of health.
My guest this week is Patty Mechael. Patty has a master's in health science and international public health from Johns Hopkins University. She has a PhD in public health and policy from the London School of Hygiene and Tropical Medicine. And currently, Patty works as a senior associate in the Department of International Health at Johns Hopkins University. She's a co-founder of Health.enabled, and she's also the award-winning author of the amazing STEM book for middle schoolers, The Antidotes Pollution Solution. Patty, welcome to STEM with Mr. N.
Thanks, Mr. N.
It's a
Although nobody calls you that, so Stuart.
no, nobody does. So it's a pleasure to have you on, Patty. But can I just start with, what does your role as a senior associate at the Department of International Health involve?
Sure. So I'm in a center called the Center for Global Digital Health Innovation. And so a lot of my work with the center includes teaching digital health to master's students, mentoring master's and doctoral students. But then also I'm a principal investigator on a Gates Foundation research study called the Digital Health Exemplars. And we are studying 5 countries around the world that are quite advanced in their digital health transformation, including Finland, Brazil, India, Rwanda, and Ghana. So very different countries, but very interesting from a learning perspective.
And could you just explain for people listening what you mean by digital health?
Sure. So, your mobile phone and your computer, and, it's all the different ways in which, we as a society are using technology to access health information and health services, and the way that like health systems are using technology to improve access to services, deliver, higher quality care to individuals.
So obviously we've just come through the COVID-19 pandemic, and during that there was a lot of countries using digital systems to try and communicate messages out, or the track and trace thing. So I take it that all falls under the digital health as well.
It does, and actually the COVID-19 pandemic really accelerated digital transformation of health in a lot of countries, mostly out of necessity. We were asked to shelter in place. We were not, so to access health services, a lot of people had to start using telemedicine or telehealth, to know when to go for vaccination appointments, or to get information explaining, information around the vaccines. There was a lot of communication, and then for contact tracing, so that we could kind of track the spread of the disease. That sort of like what you talking about, that sort of track and trace, who was interacting with whom, who saw whom the last time, and who may have given COVID to whomever else got COVID.
And as another part of this, when we're talking about digital things, obviously part of the danger with digital, separate from the digital health systems, is the spread of misinformation. So how is that combated from a public health point of view, and even through the digital health?
Sure. So we have a whole new field that was created during the pandemic called infodemiology. So if you know epidemiology, which is the study of diseases, out of the pandemic came a new emerging field called infodemiology because there was just so much information out there. And a lot of the information was misinformation and disinformation. And so and unfortunately, we're in a situation where it's very difficult to really tackle that, particularly when it's being spread through channels that are not necessarily like health channels. So you have social media platforms through which a lot of misinformation and disinformation is like posted and spread and promoted, oftentimes to sell products and services and as clickbait, and not necessarily because of the information that they're sharing. It's just that lies tend to get more clicks than the truth, and so then it creates this wild spread of misinformation and disinformation. And even a lot of the activities to do, fact checking and to try to pull misinformation and disinformation down, from different social media platforms was like putting like a teeny tiny band-aid on, a massive gaping flesh wound. And so it really didn't really address the issues. And an amazing article and study was done that was published in Science that kind of showed how the underlying architecture, particularly of Facebook, even with having fact checkers, like created other ways that then increased the spread of misinformation and disinformation that were then like undetectable unless you went looking for it. And so it was just really interesting to kind of see how, even the technology itself is kind of structured in a way that enables, the spread of misinformation, disinformation in really unfortunate ways.
So how can people make sure that the information that they are accessing is accurate information and it's not disinformation that's being spread?
Well, for medical information and health information in particular, you know, don't use social media as your source of information. It's sort of like the number one, takeaway. It is not a good source of health and medical information. That, there are reputable sources of health and medical information, including, the World Health Organization. In most countries, there is a Center for Disease Control, a Ministry of Health that is responsible for communicating with the public, using facts and science. And so the source of the information really matters.
And I feel this is something that we could keep talking about for a long time, but the purpose of this, of course, is to find out about the different aspects of your STEM career. So I'm going to move on now from that to Health Enabled. So I'd said in the introduction that you're a co-founder of Health Enabled. Who are Health Enabled and what do they do?
Sure. So Health Enabled is a global nonprofit, and our focus is really on global health equity and leveraging technology and including generative AI in ways that can help achieve global health equity. So we look at whole person health, really, how are individuals maintaining physical, mental, and social health and well-being. We look at technology in everyday life, and digital health and the use of digital health tools to improve access to health and delivery of health. And then we also look at equity, but with a specific focus on, those that are largely underrepresented in the technology and in the health ecosystem. So this is, women, people with disabilities, individuals by racial or ethnic background, language. A lot of times, in most technology platforms, most of the information is, available in English, and the coding for a lot of this stuff is in English when, the majority of the world's population does not communicate in English. And in many countries, you might end up with like, 50 or 60 different indigenous languages, and we're not really, looking to see how do we make sure that these like tools and technologies that are now being increasingly used to improve people's health are being approached in a way that is like responsible and equitable.
So are there particular countries that you focus on around the world? Like, do you specifically focus on developing countries, or do you try and operate in as many locations as possible?
So historically, we have worked largely in low and middle income countries, so mostly in Africa, Asia, a little bit in Latin America. We do have a platform that we helped co-design and are now moving into the World Health Organization called the Global Digital Health Monitor, which is a global platform that helps countries to like measure and monitor their digital health maturity. But a lot of our work is really, focused on underserved and underrepresented populations. Increasingly, we're starting to look at the United States because there are, parts of the United States that, resemble and don't look that different from parts of, Kenya or Ethiopia or Nigeria, or Thailand, frankly.
I think it's great that you're focusing on the underrepresented people and helping trying to sort of raise that floor up to be level with everyone else. And I know representation is something that ties into something else that I mentioned in the introduction, which is about being the award-winning author of the Antidotes Potion Solution. So could you tell everybody a bit about what the book's about and why you wanted to write it?
Sure. So Gear and Izzy are the two protagonists. They live in a community in Maryland near the Chesapeake Bay, and they start smelling something very fishy in their town. They're fifth graders, and so they uncover a plastic eating bacteria experiment that has gone wrong, and it is making fish and kids sick. And so they have to use, epidemiology and other basic, STEM skills to wrap their heads around the problem and map out the disease, and then come up with age appropriate solutions to the problem. They do a little, disease detective work. They do a lot of sleuthing. They sneak around, and they have fun. And of course, because I had, this male and female protagonists, I wanted to use the book to kind of like illustrate the importance of diversity, equity, and inclusion in the sciences. And so there is a competitive nature in the male character, and a very sort of, shy nature in the female character, and he's outraged that she's, better in some ways than he is at certain things in science, and she doesn't want to overstep. And so, but they, kind of learn, and they discover that by coming together, they can come up with much better and even more effective solutions, because they bring something a little bit different into the scientific process and into, coming out with a solution.
And what inspired you to start writing a STEM book for that fifth grade, middle school sort of age group?
Sure. So right at the start of the pandemic, I was in New York for the Society for Children Book Writers and Illustrators Conference. And I had won the opportunity to pitch a young adult novel that I was working on, school shootings, which is a big challenge in the United States. And I was told by the agents in the pitch competition that, I was a really great writer, but to write about something different. that, one of them had worked on a school shooting book and was just like, it was a really great book, but it was like really difficult to get people to kind of like pay attention to it, etc. At the same conference, there was a lot of discussion about how there wasn't enough kind of like smart, sciency, middle grade fiction. And at that time, I had a 7-year-old at home, my son, and we started to watch the pandemic unfolding. And so this was in February of 2020. Was it 2021?
2020 is when it first started.
2020. So it was like February of 2020. And, March 2020, everything shut down. And so we were kind of like, chit-chatting. And I was like, we wouldn't be in such a mess if kids were in charge. And my son was like, yeah, we wouldn't be in such trouble if kids were in charge. And I was like, what if we wrote a book about a group of kids that, stop a future pandemic before it starts? And I still have these pictures of the Post-its where we created the characters and the story. And the original title was Disease Stoppers. And then we just kind of created this whole story together, and just had a really good time doing it. And then as I wrote, we would sit down and read different chapters together, and I knew I was onto something if he laughed. And I knew I was like, headed in a totally wrong direction if he looked at me and was like, what are you talking about? And so he became my like beta reader, and which was great. And so we had a really good time, collaborating on it.
And it's great that it was being inspired by children and written to inspire children, which is a nice hook for me to come to. When you were younger, what first got you interested in STEM?
So I loved doing home experiments, and which is kind of funny that you're a kitchen chemist, because I was like, but I would like create them by myself. I didn't have like, like knowledge of stuff. I'm like, what if I took this and I mixed it with this, or what if I did this and I did, and I had this kind of like creative side to me, experimental side to me. And it was as I was sort of, I think it was around the fifth and sixth grade that I really started to become interested in science, and then also in health, like in how do we help people. I was really interested in helping people. I was also super artistic and creative, but because I was, an Egyptian immigrant kid, like there was no way my parents were going to agree to let me be an artist or a musician or whatever. It was like, you're going to be, the family medical doctor. And so that was, definitely the path that I was on. And then in high school, I became, the head of my science club, and got, really great opportunities through the school to partner with universities on, science activities and competitions and that sort of thing. So I always sort of had that, interest, and then found ways to kind of cultivate it.
And it's great that there was a lot of support that you were saying there from your high school, because that's obviously something that is a big talking point in STEM. It's about female representation in STEM and in different fields. And I know in general in the biological sciences, females are quite well represented. Is that the case within the public health sort of field?
So we're very well represented in the field itself, but in leadership positions, so you have a lot of women in public health. Leadership roles, however, particularly in global health, are, less than 20% female, which is really, you know, a shame because there's a lot of women that, are working in the field. Women, comprise the majority of health professionals in the world. They also comprise a lot of, people in the biological sciences. But then when it comes to leadership, there's this sort of like gap between those that are doing it and then those that are leading it.
And do you think it makes a difference if children and young people can see somebody that looks like them, similar sort of background or gender or whatever? Do you think that helps inspire people get involved in STEM?
Absolutely. I mean, I went to an all girls high school actually, and I had science teachers who were spectacular, including a science teacher who was from Liberia. She had a PhD in chemistry and she taught physics and chemistry. And she was the one who really inspired me to want to pursue a career in international health. And she even introduced me to like the World Health Organization. She's like, it sounds like the sort of thing you want to do is the World Health. And I had never really thought about it that way. And it just made such a huge difference to have that. And then recently I was giving a talk at a middle school and high school like feminist group. They wanted someone who is in a woman in STEM to come and kind of share my experience, my journey, etc. And somebody came up to me afterwards and introduced herself and said, my dad is Egyptian and I really like science and art. She's like, thank you. Thank you for showing me like what it can look like. And I was just like, oh my, you never know, right? When you do these things, if there's like if it even like makes any sense to any of the people that you're like talking to. But it was just so beautiful and poignant and really even made me want to be kind of more visible as a woman in STEM, like even more than I had ever wanted to before.
And that's why I'm so appreciative, and I think it's great that you're coming on the channel to talk about your experiences to hopefully help inspire more people. Which brings me around to my final question, which is, what would you say to children and young people who are perhaps interested in STEM, but they're not sure where they can go with it or what they can do with it?
Sure. So, STEM is not, one thing. There's a lot of, creativity. There's lots of different roles in STEM. So don't put one thing in your mind of what it is to be a person that is engaged in STEM or can engage in STEM. It's really about, identifying problems and then looking, for solutions in systematic ways and kind of testing out different ways to solve different problems and address different problems. And I, firmly believe that young people are entirely, knowledgeable and capable of like understanding many of today's, challenges and problems and coming up with their own solutions. You see so many of these young people getting more and more active in, climate science and in helping to keep our planet, safe and healthy and resilient, individuals, taking meals. I mean, I think it was really beautiful during the pandemic. Young people really stepped up in a wonderful way where they would, you know, identify that there were older people in their community that couldn't go to the grocery store themselves, and they came up with their own solution, which was to like go and, you know, do the grocery shopping and deliver groceries, you know. And so, you know, these are the things that I feel like, you know, it's what gives me hope. I feel like a lot of our young people, I think they underestimate, you know, who they are and what they can contribute. And so I would just say, you know, if there's something that you're interested in, like pursue it, you know, bring people along with you who can pursue it. Have fun doing it. It should be fun. Life is too short to not have a little fun while you're, you know, solving big existential threats and problems.